Are you considering doing a breath test because you think you have SIBO or small intestinal bacterial overgrowth? Well, before you do, let's talk about it. Hey guys, I'm Dr. Arland Hill, and I'm going to share with you 7 reasons why you may want to think twice about following through with the breath test if you're suspicious about having small intestinal bacterial overgrowth. So let's just jump right into this. The number one reason is that this is not the gold standard. Despite that, the breath test is by far the most talked about test when it comes to SIBO and helping to diagnose SIBO. It is not the gold standard. In fact, the gold standard is actually what's known as an upper GI aspirate, where a sample after going through the mouth, through the esophagus, past the stomach, into the upper small intestine, a sample of microorganisms are taken, they're plated out, and if the count on the plate, the number of microorganisms exceeds what the considered threshold is, if it's above that, you're considered to have SIBO. Now, granted, most individuals aren't signing up for this type of testing. It's invasive. It's certainly going to be a high cost, especially when you consider against the breath test. And the breath test, of course, is a non-invasive option. But the point here that I'm trying to make is that it's not the gold standard, regardless of how much you hear about breath testing compared to other tests that are out there. And that's not to say that the upper GI aspirate is perfect by any means, because it's certainly not. It's certainly been noted that it has its limitations as well, but definitely worth noting. The second reason that I'll give you for maybe considering passing on doing a breath test is that it doesn't change the treatment. Regardless of what findings you have, whether those are going to be elevated methane production, elevated hydrogen sulfide, if the testing looks at that, or some combination thereof, it typically isn't going to change what the intervention is going to be. If you're going the conventional route, you're probably still going to end up starting with the antibiotic rifaximin, since that's generally considered to be the antibiotic of choice for bacterial overgrowth in the small intestine. If you're going the non-conventional route, looking for options outside of antibiotics, then you're looking at botanicals and herbals. And there are some botanicals and herbals that have been shown to be beneficial against SIBO, and those are going to be a better option for you. So the testing doesn't change what the intervention is going to be. If you do the test and it shows positive for methane, or if it shows positive for hydrogen, you're still likely doing the same intervention as your starting point on that. So second reason is it doesn't change the intervention. The third reason that I'm going to give you to consider maybe looking past breath testing and looking elsewhere as your starting point is that breath testing doesn't tell you anything about the cause of SIBO. And I think of all the reasons that I'm going to give you, this might be the most important, simply because when you look at SIBO, it has a high recurrence rate. Almost 1 out of every 2 individuals that are diagnosed with this relapse in about 9 months. That's a very quick relapse rate. So if we want to make some headway and not be on that loop, then we need to deal with the causes. And whether that's going to be low acid, low enzymes from your pancreas, low pancreatic enzymes, low bile production from the liver, and then from the gallbladder being secreted into the small intestine, or whether that's some type of altered motility. Slow motility typically ends up being the more common problem as it relates to SIBO. Regardless of what underlying cause you have, if you're not dealing with that underlying cause, you're likely going to have SIBO manifest again within a year's time frame, 9 months for 1 out of every 2 individuals, as far as the numbers go in the literature on that. So breath testing doesn't tell you what to do as regards to which direction to go to prevent your recurrence. So that's the third reason. The fourth reason that I'm going to give you on this is that intervening with a stool test or using a stool test actually shows no better outcome than just starting with an empirical treatment. So what's an empirical treatment? An empirical treatment is you and your provider, however that looks in your situation, makes the decision that you have SIBO and they put you on a course of antimicrobials for that, and the antimicrobials resolve your case, well, you just had a diagnostic and a treatment all at the same time, because if you got better from the treatment without doing the testing, well, you had a response to a suspicion of SIBO, and you most likely had SIBO. The treatment told you that based on your response to it. And that typical course of action generally shows no lesser outcome than doing the breath testing prior. So, in fact, in most conventional circles, if there is suspicion of SIBO, rifaximin is the recommendation. So why not just go ahead, reduce the time frame that you're going to be dealing with this, shave 2+ weeks off of the time that you have until resolution of your situation, and why not just go ahead and start with the treatment process, since it shows to be just as equally or just as beneficial as going through the diagnosis process with a breath test. So for consideration. The fifth reason that I'll give you is that breath tests have a high false negative rate. If you've heard the term sensitivity, specificity, this is what we're getting into here. So when you do a test, when you do a lab test, if it shows positive, you indeed want to know that what it's showing positive for is actually what's going on within your body. And breath testing overall, as far as it relates to a positive finding equating to a true overgrowth of bacteria in your small intestine, breath tests are pretty good at that. However, the opposite of that is not true when it comes to looking at what we would classify as specificity. And specificity is more along the lines of, if you have a negative outcome on the test, you need to know that that is absolutely not what you're dealing with or what you were suspicious of by doing the test. So if you were doing the breath test in the case to diagnose SIBO and it showed negative, and now you're drawing the conclusion that you don't have SIBO based on that breath test, I tell you to hit the brakes on that, because that may not be the case. Regardless of whether or not that test showed a false, or regardless of whether or not that test showed a negative, you may be still dealing with SIBO if you're dealing with the symptoms that are associated with SIBO. So that's my fifth reason, is there's a high false negative rate. And it also leads me right into the sixth reason, which is that symptoms are often just as indicative of the fact that you're dealing with SIBO as the test is going to be. Gas, bloating, distension, maybe it's painful, dealing with changes in motility, which could be both constipation and or diarrhea. It could be mixed as well. If you're dealing with some nutrient deficiencies, especially if these are ongoing, like B12, iron, zinc, selenium, micronutrient testing can show you these things. If you're having issues with fat malabsorption, these are all, the more of these boxes you check, the more it's pointing towards SIBO. And if I'm checking a lot of these boxes, I don't need a test. I just need to get down to start treating. And so when it comes to symptoms versus testing, I'm going to go with the symptoms. And here's the other thing again, guys, I repeated this when one of the other reasons that I gave you is that if you go off of those symptoms because they're heavily pointing in the direction of SIBO, and you go ahead and start treating and don't wait until you go through the process of doing the breath test and getting the breath test back, then you're shaving time off of your treatment, and you're shaving time off of to the point that you're going to resolve your symptoms and hopefully resolve this overgrowth that you're dealing with. So that's point number 6, is that symptoms are indicative of SIBO, heavily indicative of SIBO. The 7th reason that I'm going to give you here is related to cost. And I'm going to speak to this from the standpoint of a non-conventional approach, since that's what my expertise is in. But when you look at the cost, first of all, let me just put this in perspective. The cost of a breath test in relation to most tests as it relates to healthcare in general, insurance or not, is not that much. Okay, so let's just put that in perspective. However, with that being said, when you compare the cost of the test against a combination of botanical, again, that's what I know, against botanical antimicrobials, most of the time those botanical antimicrobial combinations are going to be less than the cost of the test. So why not go ahead and just do the antimicrobials? You're going to have more value on your investment because you're getting to your resolution of your symptoms faster. And so my suggestion would be forego the breath test. Now, you probably have listened to this if you've gotten this far and you think this guy doesn't like breath testing. And I'll tell you straight out, I don't do breath testing in my practice, but I'm not anti-breath testing either. And the reason being, again, is that if it does show a positive, the likelihood that you have a positive for a true overgrowth of bacteria, you probably are dealing with that. But just know that if it shows negative, it doesn't mean that you're at the end of the road as it relates to SIBO. You need to keep looking and you need to keep digging. And it also means that you're going to have to also figure out how you're going to deal with your underlying causes that allowed you to manifest SIBO in the first place. So all of those have to be calculated into the decision as to whether or not you're going to move forward with doing breath testing or looking at other options for you. So hopefully those are a few things for you to consider. If you're working with a competent practitioner around this topic, hopefully those will help you and aid you and give you some talking points to discuss with them. So you guys can hopefully come up with an effective strategy to resolve your situation. And again, just hopefully you found this information insightful, guys. Until next time, I'm Dr. Arland Hill. We'll talk to you soon.